What should you do after an accident or a fall from a height? The first thing that we should do is to seek help from trained professionals. For example, in the case of an injury to the cervical spine, which is the neck, the spine that is within the neck, if it should be handled by a person who is not trained in the safe care of cervical spine injuries, that would lead to even further injuries. So the first thing to do is to seek for professional help. Even at the side of the roadside, we should be able to call in ambulances that will be able to ferry you in a safe manner to the nearest hospital. If, for example, you have had an injury and you do not feel that you have gotten a serious injury, it is still very important to go to hospital, to have a doctor examine you, and to do the relevant images that we call the trauma series, to be able to evaluate your injuries. And if you do not have any injuries, then you can be sent home with a clean bill of health. I look at it in two ways. So, what will be my response as a trained first responder, and what would be my response as an untrained first responder? So, the layperson or the untrained first responder, the first thing that you should do, you approach the injured person. The first thing to do is to call out their name. So, if they can be able to say their name, that makes sure that their airway is patent, they're able to breathe, and then from there, those are the first two things that a patient will succumb to after an injury. As you're checking for this, one of the most important things to do is to call for help from trained personnel. So, as a trained first responder, we go through our ATLS protocol where you check for the airway, and airway is combined with stabilization of the cervical spine. So once the ambulance comes, then the trained personnel will be able to secure the airway either through an oropharyngeal airway or intubation. Other mechanisms also through a tracheostomy if there is upper airway injuries. Then from there, as they are managing their airway, the cervical spine is also immobilized. It is important to assume every trauma patient has a cervical spine injury, and if they do not have a cervical spine injury, that assessment will be made when they're in hospital. They will also check for their breathing, how their chest is moving, and also their circulation, and also to look for places where the blood might be going. Other things that we look for in terms of your disability includes your consciousness level, whether the patient is conscious and at what level, using the Glasgow Coma Scale. Then from there, you expose the patient and immobilize the patient as you transport the patient to hospital. In a large percentage of patients, X-rays are the most important. The X-rays will show us bony structures. In the setting of the chest, will also be able to give us a bit more information about how the lungs are working as well. So a CT scan is important especially in evaluating for head injuries. You'll be able to find bleeds. You'll be able to find shifts in how in the brain's anatomy from the CT scan. An MRI maybe would be, in my setting, would be most important when I'm evaluating for spinal cord injuries. So if I am noticing that the patient has an injury, we'll start with an X-ray that will help me narrow down where the bony deformity or the bony injury is. The CT scan will give me more information about bony anatomy and bony injuries. Will be able to tell me about facet joints, whether those are broken, and help me even in my fixation when I'm going to treat this injury. And then the MRI will give me information about what the discs within the spine are doing, and also what the nerves, the spinal cord, and the exiting nerve roots are doing as well. So different images have different applications in a clinical setting, and your doctor will be able to prescribe what is most appropriate for you in the setting that you shall be in. Visit us at Apex Orthopedics at 5th Avenue Suite. We are here to take care of your pain from trauma, from back pain and also from joint pain from arthritis. Karibu Apex Compassionate Care.